Are you your doctor's customer? Seriously, are you your doctor's customer? Hello, I'm Dr. Stephen Schimpff, and this is a continuing series on the crisis in primary care. Last time we talked about listening as a key element and part of the real crisis in care. Today I want to talk to you about are you the customer? Well, it turns out you're not. Your doctor knows that the insurer is his or her customer. Why? Because the insurer is going to determine if the doctor gets paid, how much the doctor gets paid, and when the doctor is going to get paid. So they are looking to the insurer, and they're going to treat the insurer like the customer. Yes, you have a professional relationship, and they're going to do their best to take good care of you, but you're not really the customer. It's an interesting problem. And it shows. Think of it this way. When you call to get an appointment, it takes an average of 20.5 days across the country right now to get, that's not an emergency, urgent, it's different, but just a routine appointment, an average of about 3 weeks. And when you get there, on average, it's about 30 to 60 minutes in the waiting room. I guess that's why it's called a waiting room. And then when you see the doctor, 8 to 10 minutes. And when you start to explain your problem, you get interrupted within 18 seconds. And if there's not enough time to figure it out, you get sent off to the specialist. So you're not the customer. If you were the customer, you could say, hey, I need some more time. We need to get this straightened out. But you can't do that because of the way the system works. It just can't be done. Of course, the reason is the doctor has to see 24, 30 patients a day to balance out the overhead costs that have been rising. And so that's the fundamental problem there. But that doesn't make it better or right. Think about your lawyer or your accountant, your plumber, your carpenter. There you pay directly, and they know it, and they treat you like a customer. Not so in medicine. But in medicine, somehow, somewhere, someday, we've got to change the system so you are the actual customer of the physician. Next time, I'd like to talk to you about why physicians are so incredibly frustrated, truly frustrated.